Well, kia ora everybody. Welcome to the next Labour Party policy announcement. I said at the beginning of the year that the cost of living was the #1 issue facing New Zealanders and that we would be looking at practical cost of living steps that we could take to ease some of that financial pressure on families. We know that childbirth and pregnancy are very expensive, very challenging and very exciting times for New Zealand families, and we want to ease just a little bit of the pressure that those families are facing at the moment. We know that maternity scans can be a really expensive outlay for families, up to $90 depending on where in the country that you're living per scan. And for families who are going through pregnancy, it can just be an extra cost at a time when they're already really stretched. So today I'm announcing that as part of our plan to introduce a Medicard, we'll be making maternity scans free wherever you are in the country. So if you're referred by a doctor or another medical professional to get a scan, you'll be able to get it for free with your Medicard. You won't have to pay any additional costs in order to access that. I know that's going to make a difference for a lot of families. It builds on the commitment that we've already made to ensure that every New Zealander can access 3 free GP visits per year. It also builds on the free cervical screening announcement that we've made. Those are the first 3 commitments that we've made associated with the Medicard, which is basically like an entitlement tracker, so people will know what they're entitled to and able to access those health services. So I'm going to hand over to Aisha to share a few more details, and then we'll be happy to take questions.
Maternity ultrasound scans are an essential part of healthy antenatal care and making sure that babies and mothers are well during pregnancy. In my medical work, I've seen the difference that having access to ultrasound can make for people. What Labour's committing to is having all ultrasound scans for maternity funded on the Medicard with a referral from the lead maternity carer or GP. So the same process that you use for accessing scans now will be used, but it will be funded on the Medicard. This will make a big difference to families at a time when other costs are a big issue, whether that's the cost of a car seat or the cost of nappies or other adjustments families make to the fact that they're often losing income at a time that they go into looking after a new baby. But it's also good health care, and what you're seeing with the Medicard is our commitment that care should not depend on your ability to pay, that all New Zealanders deserve the same entitlement to care.
How many additional scans do you expect as a result of this policy?
I think there'll be a modest increase in the number of scans. Over 200,000 scans are done each year, and it's important maternity ultrasound scans are claimed for each year, and it's important to remember that there's a wider number of ultrasounds overall that are done, so any uplift in demand will be managed within that overall capacity.
Do you have a number?
We think many people, a few people go without, but much more people are paying for their scans and they're not able to pay for other things that they need as a result of it. So we think there'll be a modest uplift. Already, the average number of scans per woman is 4.9.
What is modest though? Because you have done some modelling in terms of the costs, so you must have kind of an idea of how much more demand there will be.
We used Health New Zealand estimates of the cost of this policy, which they provided in advice to the Minister. That's been publicly released.
So say you find out you're pregnant, you go to the GP and that's what you needed to get, a referral. Does that come off your Medicard as one of your free GP visits?
All maternity care is already free, so that the GP visits are in addition to that. And remember that both GPs and lead maternity carers can claim for services under the notice, which is how maternity care is funded.
What is this going to do in terms of the access to midwifery care already, which is stretched?
Well, this is making an important part of midwifery care free, and midwives are an essential part of that workforce, but it doesn't impact that workforce. It is the sonographer workforce that delivers scanning. Part of our commitment is an increased number of training positions in Health New Zealand so that we can grow the number of sonographers that we need.
How many of these scans are delivered by outsourced scanners?
The majority are, and though the majority of the scans are delivered by private providers in the community, women who are under specialist care in the hospital can often get those scans for free in the hospital. It really varies substantially region to region, whether the mix is what the proportion of hospital versus community is.
So those outsourced scans are already partly funded, right?
That's correct.
And so you'll just be making up the difference?
That's correct, and there's already some subsidies. There is a patchwork of subsidies across the country. Interestingly, many rural DHBs had already made these free. And you can see great results as a result of that. In Tairāwhiti, there is no disparity between Māori and non-Māori in terms of their access to scans because it's free there.
What's prompted this policy? Like, how do you have any figures around how many people are not having access to this care or are putting this off?
Well, Labor's committed to making a difference to the cost of care and making sure that we're changing the health system in a way that gets people accessing preventive care in the community, saving us costs down the line. Directly in answer to your question, there's in 2022 was the time the last maternity consumers survey was done. In that, 1 in 5 people reported that the cost of ultrasound scans was an issue.
Why do you need to use the Medicard for this or any of the other entitlements? Is it a bit of fancy branding? Surely the IT systems will exist regardless of whether you have the card or not.
Well, you do need to use the Medicard for the 2 previous commitments that we've announced to track your entitlement to the free GP visits. That's what the Medicard does. And in addition, the commitment around cervical screening might be done in a clinic, but it might also be done in the community, and it's an opportunity to identify yourselves there. When it comes to this particular commitment, of course there are other ways of funding scans, and that happens, but it is also a far more efficient way of helping midwives identify their client when they first arrive. Many health practitioners have to call a Ministry of Health hotline to confirm their patient's identity when they start. All of that will be faster and easier with this.
Do you have any more announcements or entitlements planned to add to the Medicard as part of the election campaign, or is this the last one?
Well, we're always keen to increase the care available to New Zealanders.
You're paying for this through the capital gains tax. The revenue of that is already going to the GP visits, the cervical screening, now this. Is there a concern that that revenue may be oversubscribed, that you might not have enough revenue from the capital gains tax to pay for all these promises?
Barb, why don't you?
No, and we still have a contingency there available as well to cover other needs, which we will do in due course, but I'm confident in the costings around the capital gains tax.
What was the level of house price growth that capital gains tax was predicated on?
So it's very conservative. At the time when we did the announcement, house price growth was about 5%. It was estimated by Treasury. We actually estimated a conservative 3% on average over the fiscal period.
Treasury's predicting 3 to 4%. So what if it does come in at that lower range?
So that's why we did a lower range and was very conservative on it.
And if things continue to worsen next year and Treasury has to downgrade their forecast
well,
again?
The great thing is we'll be in government and we'll have an ability to change it. But
change what?
Well, when we get into government, if we need to do the costings, which we'll have Treasury resources to do that, but that's why we started with a very conservative 3%.
So those costings, you might find the money from elsewhere to pay for these policies?
I'm confident in the costings that we've used. We've used Treasury data as well, and that's why we chose a conservative figure.
But if the house price growth is lower, you're going to have to find the money somewhere else, aren't you?
Every government has to make those choices, and every forecast will obviously be updated as part of normal governance.
So where would you look for that additional money?
I'm not going to cross that bridge today because I'm confident in our costings, and we'll cross that bridge later if we have to.
It's important to remember Nicola Willis's entire budget is based on a projection of 3 to 4% house price growth. So if house price growth is lower than that, then there are going to be a lot of areas of the government budget that we need to look at again.
Yeah, I understand that, but the capital gains tax is directly related to house price growth, right? Because that's how you get capital gains. So that will have a direct effect on how much you will be able to fund these additional policies.
Which is why we used a very conservative figure.
Is there a cap on the number of scans that a pregnant person can have in a year?
No, not under this policy or now. As I said, the average number of scans is almost 5 in New Zealand. A minimum number is 2. That's the minimum recommended in the ultrasound guidelines. And some conditions do require frequent scanning, particularly in the last trimester of pregnancy. So some people, I guess, could come close to 10 scans.
How much is it costing per scan, roughly?
Well, we relied on total costings used by Health New Zealand when they costed this policy for the current government.
Is this the last policy that you'll announce the ring-fenced capital gains tax funding for?
Well, future policy announcements will be made in due course. We still have decisions we might want to make about the Medicard versus other priorities in the health system. The capital gains tax money is all ring-fenced for health funding.
So there may be more policy on top of this with that money, or that money's going to
Let's just focus on today's announcement, and we'll get to future announcements in due course.
Just on the Medicard, are there existing entitlements in the health system that you might want to transfer over to that? So not new announcements, but could it be a tool for carrying a greater range of health entitlements?
It could be. In a joined-up primary care system where you're able to identify yourself easily whatever provider you go to, that would be a great help. However, we're not campaigning on those sorts of benefits that require work in government.
Mr. Hipkins, just on tax, is capital gains tax and changes to interest deductibility the only tax changes that a Labour government would make?
We set all of that out when we set out our capital gains tax policy. This is the major tax change that we're campaigning on here. We've also been clear that there are annual adjustments that happen, year on year to different tax settings. Many of those are baked into the system already. We're not proposing to change those, but the major changes that we're campaigning on are capital gains tax, and we've set out our interest deductibility policy once we've made final decisions on that.
What about digital services tax?
You could call that a tax or a levy. We'll set out our own policy on that in due course.
So there is a chance that there will actually be an additional tax?
We'll set out our own policy on some of those other outstanding issues in due course.
Can you see how people might be getting confused? You're talking about only having a simple targeted capital gains tax, and now you're saying, well, actually, down the road we may announce a policy on another tax.
Well, Nicola Willis is announcing new changes of taxes and levies all the time.
Can I ask about Immigration New Zealand? What do you recall about Immigration New Zealand's biometric capability upgrade from your time in Cabinet?
I know that it came towards the end of our time in government when I was the Prime Minister. The then Minister indicated that they didn't want to provide any further funding for that initiative. And then obviously we left government after that. And so what's happened subsequently to them, I understand, is now the subject of a review. We'll look forward to seeing what the findings of that are.
Erica Sanford claims that officials deliberately misled both her and Labour ministers about the project. What is your response to that?
I think I'd like to see more information about that. So I welcome the review. I think that's a good, healthy thing in a democracy. If there has been any underhand tactics there to withhold information from ministers from whichever government, we should get to the bottom of what's happened there. But I do understand that the minister in the government that I led was briefed on that project and decided not to ask for more money for it.
It's quite a scathing review. Do you think that head should roll?
I need to see the details of that first.
The Green Party is going to put out their tax policy this weekend, and they aim to tax the super wealthy. Would a Labour government ever implement the likes of a wealth tax or an inheritance tax? We've
been very clear that those are off the table for us in the next term of government. We've been clear that capital gains tax is on the table, only insofar as what we've committed to, which is a limited targeted capital gains tax, and that's our position. And the Greens can campaign on whatever they like, and of course, it's a democracy.
So if the Greens put that as a bottom line of coalition negotiations, you'll walk away?
No, I've been very clear we will not support that after the election.
So you'll walk away from coalition negotiations?
I don't think it would ever come to that.
Did the previous Labour government ask enough questions about the biometrics project?
I haven't actually been fully briefed on that. I only just saw that information in the car on the way here. As I said, what information I have been able to get in that short space of time confirmed to me that the previous minister did say not providing any more information or any more funding for that project.
Was Michael Wood or Andrew Little the minister?
So my understanding was Andrew Little at the end. Yeah, was the one who made that decision not to put more money into it.
Just on the maternity care, the budget funded 3-day stay in hospital for women who've given birth. Is that a policy that Labour would continue through?
Did it? Did the budget fund a 3-day maternity stay for pregnant women? The funding provided in the budget was half what the Ministry of Health estimated would be needed to deliver that policy. in the first 2 years of the policy, where the National Party says they will be serving new mothers, they have allocated $1.6 million. I struggle to see how you can buy enough for what must be 20,000 women, enough bed nights in order to support that policy. So we have questions to ask about that at estimates.
Would you not to fully fund that policy? Would you support the idea? Is it something that Labor would campaign on, actually implementing?
Well, we have voted for the bill at first reading and subsequently, and we support the principle of mothers getting the maternity care they need and the postnatal care that they need. We're yet to see if we're confident in how the government is funding it.
You support it in principle, would you fully fund it?
Well, the onus is on the government when they have made a commitment to New Zealand women to fund it properly. That's what we're doing in our announcement today. On the other hand, they seem to be rolling out something where the numbers just do not add up. $1.6 million and saying they're offering a service to new mums doesn't really seem all that credible. Then the full funding is in place in 2029. How can this be anything other than a broken promise when they campaigned on doing that this term?
Yeah, you say you support a principle, will you fully fund it?
The government needs to fund their commitments properly.
Will the Labor Party fund it?
Well, why should we assume we have to fund any extra when the government says it is? So they need to be able to explain, and we have the estimates hearings tomorrow in order to go into it. They need to explain that they are fully funding their commitment, and then we might be in a position, if those explanations are convincing, to say we would.
A lot of Will you lay out your exact plan for pay equity, restoring pay equity before the election?
Yes.
When are you going to do that?
Well, we're not doing it today.
But the National Party is making a huge deal about the size of that figure. Wouldn't it be better to come out to the public and say, here's what we're estimating, rather than just letting the National Party create a vacuum?
The reason Nicola Willis is so busy scaremongering about the Labor Party is she knows she can't campaign on her own track record. They promised to grow the economy, they shrunk it. They promised to get people back into work, more people are losing their jobs every day. They promised to fix the cost of living has never been higher. There's a reason Nicola Willis is spending all of her time sitting in the beehive wondering what the Labor Party's up to. It's because the job of being Minister of Finance has clearly gotten too much for her and she's lost control of it, doesn't know how to balance the government's books, doesn't know how to help New Zealanders with the cost of living, and has basically given up on trying to govern and is now just trying to scaremonger about the Labor Party.
What is the current roadblock to putting out Labor's pay equity policy?
Oh, we'll set out our own policies on our own timetable.
If your estimates end up to being $11 billion, we pay $11 billion.
No, we'll set out our own policy and our own estimates and on our own timetable. And Nicola Willis can just fret a little bit longer.
If they end up being $11 billion, will you pay $11 billion?
Look, we'll answer when we announce our pay equity policy. We'll answer all of your questions on it.
Did you know that Ginny Anderson had promised to stop universal testing of primary students?
The Labor Party's long-standing position has always been opposed to mandatory national testing of primary school kids. We think that kids should be assessed regularly and that the results of that should be reported to parents. But we think that schools should have choices around the tools that they use to do that. Some schools use PAT tests, for example, been around forever. I did them when I was at primary school. Some use a tool called eAstal, which is basically like a digital equivalent of PAT tests. And we don't think that the government should be mandating one form of test for every child in the country.
The feedback from readers saying that they've enjoyed these tests, that they've found it very easy to use, easy to understand. So why is a Labor Party education spokesperson saying they're not any good?
We've said that we're not going to be supporting compulsory, mandatory national testing in primary schools. Of course, we have always supported a good, regular assessment in primary schools and for those results to be reported to parents. But there are a range of tools out there that you can use to do that.
Would it be good, though, to have one consistent tool to assess those students?
Not necessarily. It depends on the nature of the test or the tool.
A lot of people, when they find out that they're expecting, going back to midwifery, they're not necessarily so concerned about paying for the scans. They'll be worrying about maternity leave and what money they're going to get when the baby is here, when they've got another mouth to feed. Is there any room in your policies to cover that off, or would that money be better spent on something like that, making sure that that people are not being disadvantaged just because they're becoming parents?
I'm really proud of Labour's track record when it comes to paid parental leave. We increased paid parental leave in New Zealand to 6 months. It was a well and truly justified extension of paid parental leave, and I know that's made a difference for what will now be hundreds of thousands of New Zealand families. We're not announcing any additional increase in paid parental leave today.
Can I just add, like as a mother of lots of children and have lots of experience in this, you worry about costs overall. Am I going to afford the scan? We're going to go down to half an income, or in our case, no income, but paid parental leave. You're worried about every single dollar, and in particular, if you're in a low income, it's even worse. So maternity scans are such an important tool. With child number 7, our maternity scan showed that there were some abnormalities that we had to go through. Devastating news. It still makes me slightly traumatic today to talk about it. But the fact is, we could pay the $30 to have the scan, get the advice that we needed. It's so important to ensure the health of your child and your well-being as a mother.
Can you talk to the kinds of situations pregnant women might find themselves in if they can't afford care?
It means that the rest of their maternity care isn't ideal. It means that your lead maternity carer can't assess you and provide you with the additional care that you need. And I know we're in Porirua and a lot of women here are missing out on it from my conversations with different midwives. But I cannot stress the importance of having a diagnostic tool to help provide you and your family the assurance that your baby's going to be okay and that you're going to be okay.
Does the Labour Party want house prices to go up?
Sorry, slightly traumatic. Let me take a breath from that. Yeah. Ultimately, we want house prices to be stable. We want people to be able to afford their first home. We want to have security of tenure. You know, having the huge spikes and the drops aren't good. They aren't good for the economy either. And ultimately, it's about being able to help people get into their first home.
Just with the UK announcing that they'll ban social media for under 16s overnight, what's Labour's stance on that?
Yeah, I support a ban on social media for under 16s. There's a lot of risks with social media and in that age cohort. We know that it can do a lot of harm, but there are still a lot of issues to work through and how you would give effect to that. So we've said to the current government, we'd like to work through that with the government in a constructive way so that what ultimately we arrive at as New Zealand is a solution that's suitable for New Zealand. They've withdrawn their bill. They've said that there's another bill coming. They haven't spoken to us about that yet. But the goodwill is still there. You know, it's a complex issue. It's not straightforward. And we're very happy to work with them on it.
What did you think of the Greens' fines for data breaches policy that they announced last week?
Certainly protecting people's private and personal information is something that every agency that holds that needs to take very seriously. It's something that we're happy to look at. I haven't had a chance to see that yet. But there are certainly parts of both the public and private sectors where there's evidence that people's data is not being protected in the way that it should be. Some of the cybersecurity risks are not being properly dealt with. And, we're open to conversations about how you can make sure that that gets fixed up.
Just on the social media ban, I think the UK is going a bit further than it's been talked about here. I think there's a curfew where kids, 17 and 18-year-olds or something, will have to turn off their phones at a certain time. Is that not nanny state behaviour? Yeah,
well, look, I haven't seen all of the detail of what's being proposed in the UK. I'm broadly supportive of the campaign that's been underway here in New Zealand around banning social media for under 16s. I haven't seen what else is being proposed in the UK, so I'd want to have a good look at what they're doing there before making a judgment call on that.
A recent Harvard study showed that only 1 in 4 Australians were actually complying with the ban. Do you have any concerns around, if this is actually going to work here?
Well, this is one of the issues that we have to work through. First of all, what do you regard it as within the social media boundary, for example? So there's some obvious, Facebook and Instagram might be obvious, but there are video games that kids play that have a social media element built into them as well. And so there's quite a lot that we need to work through there around how we keep kids safe online. And no ban is ever going to be perfect. And I think any politician who says that we could just ban it and it's all going to be easy and it's all going to be straightforward, it's all going to be very simple and you're going to get an instant result, isn't being upfront and honest about that. There's a lot that you need to work through, and education has to be part of that. You've got to educate kids about how to keep themselves safe online, what to do and what not to do. And if anything, that's actually far more important than any technical solution, because there will always be a way around a technical solution. So you've got to have the education in place as well.
Are you open to the
Sorry, just one more question
Yeah.
on that. The Children's Commissioner released a report just kind of canvassing the opinions of under 16s, and I've spoken to a whole bunch of kids as well. And a lot of them say if it's, you know, they've got concerns about adults that actually use social media as well. Do you have anything to say around, you know, if adults are wanting to ban social media for under 16s, maybe we should look at some other restrictions for people that are over 16?
Look, overall, my observation would be that social media is getting less and less social by the day. There are people who are, you know, displaying very violent and aggressive behaviour on social media. It is a huge risk for radicalisation. There's a world of evidence out there about that. So by no means is a ban on under 16s a magical solution that's going to solve every problem with social media.
Are you open to the possibility that it's just not actually the right policy tool to address this problem, that education, like you say, might do better, but actually the ban won't do anything, or could have a negative impact?
Look, I'd start with education first, of course, but are there technical solutions? Should more emphasis go on the social media companies to, you know, do more to keep kids safe? Yes, absolutely. And a social media ban can be part of that conversation. So I'm very open to that. But I think, do we need to do more to keep kids safe online? Yes. Unequivocally, yes.
Are you concerned that the government haven't approached you at all about this bill?
Well, look, we've extended the olive branch there for, well, 2 years, I think we've been talking about it now. Thus far, they haven't taken us up on that. We were talking to them about the members' bill that was there. We'd indicated we would support that, at least to a select committee, so we're going to have many of these conversations. They've now pulled that bill and said they're doing something else, but they haven't spoken to us about what else it is that they're doing.
Thank you.
All right, thanks everybody.